Welcome to this EquiLymph informative video, medically correct lymphatic compression for the treatment of tendon injuries and tendonitis. Why do we use compression on tendon injuries? Compression therapy is a broad term used to describe the process of reducing swelling by helping remove waste material from the affected areas. This allows dissolved oxygen and nutrients from the bloodstream to enter the area where they provide the essential elements to help keep cells and tissue healthy. Compression helps reduce the inflammation, bruising, and localized swelling that accompany tissue injuries. As many horses will be on box rest during their recovery, compression helps to stop the lymphatic pooling that occurs when horses are unable to move freely, as restricted movement and the inability to flex the fetlock joint affects the ability of the lymphatic system to transport lymph and waste out of the lower limbs. The lymphatic system drains waste material from the body in a clear, colourless fluid known as lymph and transports it through a series of lymph nodes before returning the cleaned lymph to the blood supply. Horses have tendons that are very lymph vessel rich, more so than lymph vessel density in human skin. Lymphatic capillaries have been found to reach further into the tendons than blood capillaries and increase in density from the centre to the periphery. Studies undertaken at the Veterinary University at Hanover have concluded that supporting the lymphatic system accelerates lymphatic drainage from the digital flexor tendons, and that this treatment is beneficial for the horses with tendon injuries. Supporting the lymphatic system assists the new collagen fibres to line up longitudinally, also making for a stronger and more effective repair. Additionally, when horses are kept on box rest, the transport capacity of their lymphatic system decreases suboptimally, hence the system struggles to drain lymph from the lower extremities. Combined with the inability to flex the fetlock joint and activate the lymphatic retraction apparatus, the system struggles to cope effectively, and this directly influences the ability of the body to heal. Even young, healthy horses have been shown to have a degree of lymphatic congestion to the distal collector vessels when their movement is restricted. Horses that suffer from stable fill, also known as stock legs, are already exhibiting lymphatic disease and would need to be kept in compression to prevent against future problems. As horses have no musculature below the knee and the hock, there is no band of muscle to act as a buffer and stop elasticated products from pressing directly against the deep collectors of the leg. The deep collector system drains everything underneath the skin, namely tendons, bones, ligaments, cartilage, and internal organs. The skin has its own drainage system, known as the superficial system, but both deep and superficial work together as a one-way system to transport the lymph. Elasticated products are a relatively recent development, the effects of which haven't been fully understood when it relates to animals who have no protective musculature like humans. Experiments show that deep collectors becoming progressively restricted when various elastic products are applied to the lower legs of standing horses, and in some instances, lymph flow is fully blocked up the deep collector vessels. Additionally, if pressure isn't correct, elastic products will tend to simply push lymph into the superficial system, where fluid accumulates and causes issues in other areas. Non-elastic compression, also known as short stretch, is the medically correct way to support and treat the lymphatic system. Non-elastic compression doesn't constrict vessels when the horse is at rest, but will act in a pulsing manner when the horse moves. And it is this action which encourages waste and fluid to be taken up by the lymphatic collectors and removed safely. Safe compression will have the following attributes to prevent inadvertent damage to the lymphatic system. Firstly, it is non-elastic and will have no more than 10% stretch in the materials being used to wrap around the limb. It will need to be applied in a manner which means it won't slip, creep, or cause ruckles, which will cause unwanted bands of pressure. It will need to be applied using gradual Graduated pressure with the most pressure distally to the lower part of the limb. Pressure then needs to reduce as it's applied up the limb. Pressure needs to be a RAL class 1 and applied to give 18 to 21 millimeters of mercury, which is the correct pressure for prophylactic use. The item providing the compression should never be able to be over-tensioned, and the item needs to be able to support the lymphatic vessels on the underside of the pastern and the fetlock joint, and therefore needs to be able to flex over articulating joints without rubbing. Compression should not be applied if there is an active infection, nor where it is contraindicated, and certain comorbidities would make horses unable to tolerate compression therapy, for example arthritis. The compression will also need to cover the coronary band without putting undue pressure on the coronary band and provide support to the whole pastern and fetlock area. The height of the compression garment is determined by how far up the leg the lymphatics are compromised. We estimate that healing rates increase between 25 and 37% by using correct medical compression as a treatment for tendon injuries. As the new collagen fibres are better able to align longitudinally, a good quality repair is likely. The German electrostatic device called the Hyvermat, or the portable version known as the Deep Oscillation Personal, or DOP, has been used in the clinical practice for decades and is utilised across Europe for a wide variety of conditions where reducing inflammation and augmenting healing rates is required. Now available on the NHS, the Hyvermat is used in lymphedema clinics and physical rehabilitation practices throughout the UK. Equilymph now have the DOP devices for hire, and more information can be found on our website. Equilymph combine many years of experience in treating both human and equine lymphatic disease with experience in textile engineering and manufacturing. The company has strived to create products to treat both primary and secondary lymphatic disease and provide support and information to both vets and owners. Equilymph recently released the double wrap garment, which is the first product of its kind in the world that actively supports the lymphatic system and reduces both skin folds and skin thickening that form in primary lymphedema, known as chronic progressive lymphedema or CPL, that affects mainly feathered breeds. This is a condition that was previously considered impossible to halt the progression of, but is now reversing due to an application of correct principles and practices of lymphatic compression. Do email us at info@equilymph.co.uk for any further information, or visit our website www.equilymph.co.uk. Thank you.